IC. Yeah. We have volunteer counselors like you who assist people with Medicare and related questions. So if you have any question regarding Medicare and its choices, you can give us a call, right? I gave you guys the brochure. If you turn it around, you're going to see our number at the back of the brochure. Okay. The easiest way to remember is 212-AGING-NYC. Very easy. Or 212-244-6469. Okay. Now, today we're going to talk about Medicare. As we all know, Medicare is a federal program, right? For the people of what age? That's it. 65 and older, right? Once you become eligible for Medicare, you receive a red, white, and blue card, right? You receive a red, white, and blue card from Social Security Administration. It talks about your Part A, right? Your hospital insurance. And your Part B, medical insurance. Part A, mostly premium free in the United States, right? For Part B, there is a premium. This year, it's $185. It's taken right out of your Social Security check every month, $185 premium. Also, you have a deductible. What is it? $257 for 2025. You pay your premium, you meet your deductible, and you pay 20% co-insurance, and Medicare pays 80% co-insurance for Medicare covered services, right? You're responsible for the 20% co-insurance. Okay. What about Part A? If you're admitted to a hospital for first 60 days, Medicare pays everything except the deductible. What's the deductible for Part A? This year, it's a little over $1,600, $1,676. You pay the deductible, Medicare pays everything for the first 60 days you were admitted to a hospital or skilled nursing facility.
Please repeat.
Yes.
Part A.
Part A. Part A is the hospital insurance. If you are admitted to a hospital for first 60 days, Medicare pays everything except your deductible. It's $1,676. You meet $1,676, $1,676. You pay that. I'm sorry. Sure, it's $1,676. Yeah, for Part A, hospital insurance. You were admitted to the hospital for 60 days. You pay only $1,676, and Medicare pays everything. Okay. Now, so far, we are talking about one way to get Medicare. We're talking about original, traditional, fee-for-services, straight, regular Medicare, right? We're talking about this red, white, and blue card, right? We're talking about straight, regular Medicare, right? We're talking about Part A hospital insurance and Part B medical insurance and gaps in coverages, right? Now, let's talk about things that are not covered by original, traditional Medicare. I need some participation here. Tell me, what are the things that are now covered by original, traditional Medicare? Okay. Hearing aids, dental, vision are not covered by original, traditional Medicare, right? Well, yes. Well, some people have retiree health insurance. Like I'm working for the city of New York for the Department for the Aging, right? If I retire with the Department for the Aging, I'm going to have a city retiree insurance, right? It's a combination of two insurance, actually, GHI senior care. Okay. Now, some people have retiree health insurance, which acts as a secondary insurance, right? Some people have Medicaid for income limitation, which acts as a secondary insurance. What if you tell me, hey, Saleh, I'm not a city retiree and I don't have Medicaid. What about me? Well, you can buy a private Medigap plans. You can buy a private Medigap plans that works as a secondary insurance. It's going to cover your 20% co-insurance. Remember I was talking about 20%, your responsibility for Medicare? That 20% is going to be covered by Medigap, right? Or Medicaid, right? Or retiree health insurance, like those secondary insurances, right? Okay. So that's one way to get Medicare, right? What about the other one? Well, there is another way to get Medicare. It's called a Medicare Advantage Plan, a Medicare Health Plan. These are private health insurance companies contracted by Medicare to cover services the original traditional Medicare covers. Also, they cover other things. I bet you have seen advertisement on TV, right? Right? Zero premium. They say like they advertise zero premium. Well, you still have to pay Part B premium, $185. They're saying no additional premium, right? they cover services that original traditional Medicare covers. Also, they cover your dental, the vision, most of the time, hearing aids. Some people even get OTC cards, right? From Health First, Metro Plus, Cigna, Humana, United Healthcare, and there are many more, hundreds of them. I'm just naming a few of them, right? There are hundreds of them. I bet you have seen advertisement on TV, right? Okay, so they cover like dental and the vision and the hearing aids. With the OTC cards, what you can do, you can buy groceries, fitness records, pay for a gym membership, utility bills, right? Internet, like those kind of things. You could like they pay for it. You get it quarterly, 4 times a year, every 3 months. Okay. So far we're talking about 2 ways to get Medicare, right? Original traditional Medicare and the Medicare Advantage plan. Here come things. Either way you go, which way you go, you're responsible for Part D. D for drug, prescription drug. Now, every time I do a presentation, I always tell the beneficiaries, if you have the Medicare Advantage plan, with the Health First, Metro Plus, and hundreds of them, you get everything under one plan. It's very important to remember. You get everything under one plan. Your Part A hospital insurance, Part B medical insurance, and Part D, that they call it Part C, Medicare Advantage, all under one plan, right? If you go with the red, white, and blue card, with the Social Security Administration, you buy a separate standalone Part D plan. Now you ask me, hey Saleh, how do I buy? Good question. How do you buy? Well, you call Medicare. Do you guys know the number for Medicare? I'm gonna tell you, 1-800-Medicare. You can't forget that, 1-800-Medicare, right? You call them. If you are like not a telephoning person, right? If you're someone tech savvy, which I'm not, you could go to Medicare.gov website and see the plans, right? There are 12 standard plans. Out of them, 3 of them are benchmark, like the common plans, right? That's what they call. You could look at the plans yourself and see which one suits for you, right? Depending on the medication you take and the number of times you have to take. So that's one way. 1-800-Medicare or the Medicare.gov website. What about the third one? Us, the SHIP counselors, right? We provide you free and unbiased information, right? You can call us. Our number is at the back of the brochure, right? Also, it is important to remember that the Medicare number, 1-800-Medicare, they're open 24/7, 7 days a week. Incredible, right? These are credible resources, right? Don't pick up calls if you don't know who are calling. You're never going to get a call from Social Security Administration. I'm telling you right now. You're never going to get a call from the SHIP counselors unless you leave a voice message. Be like, hey, Saleh, give me a call back, right? We are certified SHIP counselors, right? Okay. So don't pick up calls and later call us. Oh, somebody scammed me. Somebody did that. No. So don't pick up calls at all. If you don't know the number, don't pick up calls. It's very important to remember. Okay. Now, as I say, with the original traditional Medicare, you buy a separate standalone Part D plan, right? Now let's talk about Part D, prescription drug plan. This year, there is a $2,000 cap limit. I'm going to explain you what is it. Anything that you pay out of pocket at the pharmacy, right? It goes towards your $2,000 cap. You have a deductible in 2025, it's $590. You pay your deductible, that goes towards your $2,000 cap. It is deducted from $2,000 cap. And everything that you pay at the pharmacy, right? It goes towards your $2,000 cap. You meet the $2,000 cap. For the rest of the year, it's completely free for Medicare covered services, drugs. You don't have to pay nothing at the pharmacy no more. You meet the $2,000, that's it for 2025. It's a great thing. You know why? Because back in 2024, it was $8,000. Yeah, you guys know it. See, I'm telling you guys, you guys know it. It was $8,000. It's a great change this year, 2025. $2,000. That $590 deductible goes towards $2,000. It literally reduces you like up to $1,400. And you pay every time you pick up your prescription drugs, you pay little co-payments, right? Yeah, those goes towards your $2,000. You meet the $2,000, that's it. You pay nothing. Now, there are some things that I want to let you know. This is September, right? You guys should receive a lot of mail from all those plans, right? Yeah, they want you. Yeah. So it is very important you read the letters, right? You talk to your provider. If you don't want to change, don't change anything. We have the annual election period coming from October 15 to December 7. If you change a plan during that time, your new plan starts on what? January 1st, 2026. I'm here to tell you guys today. So before making a decision, you call us. Before making a decision, you speak to your doctor. All right. I'm standing here today. I'm not selling you guys nothing. All I'm doing is providing you guys information. That's my job, right? Providing you guys information. Okay. So when you guys get calls from the sellers and receive letters from the sellers, make sure you are aware what are they for, right? Okay. All right. So far we talked about 2 ways to get Medicare, right? We talked about original, traditional, fee for services, straight, regular Medicare, right? We talked about Medicare Advantage plan. We also talked about gaps in coverages, right? What original, traditional Medicare does not cover, right? We also talked about co-payments, deductibles, co-insurances, right? Okay. Last but not least, I want to talk about a program. It's called Medicare Savings Program. Anybody heard about it before? Medicare Savings Program? No. Okay, let me tell you. If you have earnings anywhere from $0 to $24.46 every month, you'll be eligible for Medicare Savings Program. If you get into Medicare Savings Program, your $185 premium for Part B is going to be right back to your Social Security check. You don't have to pay that no more. So think about it. If your earning per month is less than $24.46, you can get into Medicare Savings Program. Also, it is retroactive up to 3 months. If you get into Medicare Savings Program now, we are in September. So you're going to be retroactive for August, July, and June. 3 times 185. That's a lot of money to me. Think about it. We at the DFTA, 2 Lafayette Street, we help you with those applications by appointment. You call the number at the back of the brochure. If you think you're eligible for Medicare Savings Program, we're going to assist you with the Medicare Savings Program application.
Repeat that, start again with that medical savings.
Exactly. I'm going to do it again.
Could you give your number? You mentioned it several times, but I don't have the brochure.
Sure. Yeah, absolutely. So it's 212
212
244
244
6469.
6469. Thank you so much.
You're welcome, Ms. Carol. The easiest way to remember is 212 Aging NYC.
212 Aging. Okay.
Yes. 212 Aging NYC. It's very easy to remember that.
Thank you.
You're very welcome. Okay. I'm going to repeat the Medicare Savings Program again. If you earn anywhere from $0 to $24.46 per month, you'll be eligible for Medicare Savings Program. It pays your Part B premium, $185 per month. It is retroactive up to 3 months. If you get into a Medicare Savings Program right now, you'll be retroactive up to June, July, August, 3 months. Yeah, very important. Yes.
Question. Does that include security income?
Yes.
It's because 24.46. But what does that 24 include? The
Social Security, your
pension?
Yes, your monthly income.
Your monthly?
Yes.
All of your monthly
Yes, all of your monthly income. If that's below $24.46, which is $2,446, you'll be eligible for Medicare Savings Program. Okay. Yeah. So far we covered about like the Medicare overview today, right? Covered about 2 ways to get Medicare. We covered about co-insurance, 20% co-insurance, which is your responsibility. We covered about co-payments, right? We covered about Part D prescription drug plan, right?
So
yes.
I am less than 24.40.
Yes, 24.46.
Right. I can get back my 185.
Yes, and it is retroactive up to 3 months. Okay. Yes. So if you are like together, it's a little more than 24.46. I would say Around 3,400 something together. Yeah, married couple. Yeah, it's a little higher.
For Medicare information, or you have to give that information
I'm sorry, like, what do you mean? Like,
if you're making 2,400.
Yeah.
Okay, I'm saying, does Medicare have that information, or I have to supply?
oh,
that?
we have to provide it. You have to provide it.
Okay.
You have to prove it that, you make less than, so that requires documentation, your social security award letter,
Right.
all those other things that you have per month.
And that goes to the city or, Medicare?
Just repeat the question then so people online can.
Oh, yeah. Okay, sure.
And I'm sorry, I didn't mean to interrupt. Go ahead.
Yeah, thank you, Barbara. So one person asked question that, like, the 2446, right? What does it count, right? 2446 counts towards your social security check, right? Anything that you got out of your pension, like your monthly income, okay? That goes towards your Medicare savings program. Okay. One person asked, give me a second. I need an affordable dental plan. Can you help? Now, with the dental plan, as you guys know, that original traditional Medicare does not cover dental or the vision or the hearing aids. You buy a separate dental plan. It's as cheap as $20, right? You could buy a separate dental plan or hearing aids plan or a vision plan. You could buy a separate plan. With Medicare Advantage plan, most of the plans, they do cover dental or the vision or the hearing aids, depending on what kind of plan you got, right? There are hundreds of plans, like I said in the beginning of my presentation, like Health First, MetroPlus, Humana, Cigna. I could just keep going on. AARP, the famous, right? United Healthcare. There are like many of them. So depending on what plan you have, they do cover mostly the dental and the vision and the hearing aids. I hope I answered your question. Okay, getting back to your question. So with Medicare savings program, right? It's only your monthly income, right? They don't care if you have 2 houses or 3 houses, right? They don't care. They care about your monthly active income. If you're single, making less than 2446, you would be eligible for Medicare savings program. And you're more than welcome to call us, and we're going to make an appointment, and you can meet us at the 2 Lafayette Street, New York 10007. That's the DFTA, Department for the Aging. We're going to assist you with the application, all free of cost. All right. And that concludes my presentation today. And I want to thank everybody that you make time for me today, for being here today. Thank you so much. If you have any question, I'll be here for.
Thank you so much for this information, especially the phone number. Thank you.
Sure.
Is the brochure available online?
So the brochure, the one that I have is not available online, but this is what I'm gonna do. I'm gonna leave some of the brochure with Barbara. So if you guys need it, so you can take it from her. So I'm gonna leave some stuff. Also, like, you can collect the number from her. And also I'm gonna put it in the chat. A second. So it's gonna be 212 aging. Let's see. So that's our number. Also, you could put 212.
A manual brochure?
69.
Excuse me, I can have brochure, I come late.
Sure. I have also English. Is there anybody who speaks Spanish? No, nobody? Okay.
When you were talking about the 2467,
So I have brochures in English and Spanish, all right? If anybody wants Spanish, speak to Barbara. I'm gonna leave some brochure with her. Also English.
when you were talking about the 24 savings plan, 2467, was that the deduction? Was that before or after deduction for me?
Oh, so there is a question in the chat, guys. There is a question in the chat. Somebody asked, with Medicare savings program, the 2446, is that amount before Part B deductible? That's your,
Take home.
yeah, so that's your take home actually. So with everything, so you pay, so you make you make 2446, 2446, and that 2446. Remember, when you get the Social Security check, your $185 is cut off right, right from the check, right? You don't see your $185, right? And the monthly income, like that comes out of that check, your Part B premium is deducted from there. Okay, it's excluded actually.
If you call the Department of Aging, would they mail you a brochure?
Yeah. Yep.
Thank you.
You're very welcome.
So it's the Department of Aging, 2 Lafayette Street, correct?
Yeah, 2 Lafayette Street. Yeah.
And
New York,
what's-
New York, 10007. Yeah.
Okay, thank you.
You're very welcome. And we're open Monday to Friday, 9 to 5. Yeah. Yes.
Go back.
Stigna? Yeah, you can go back to original traditional Medicare during the annual election period coming, which is October 15 to December 7. But before that, I want you to consult with your provider or your primary care physician or the specialist that you go to, whether they're going to take the Red, White, and Blue card. Very important. Okay.
All right. Do you want to?
I have another question.
Any other question? Yes.
Can you explain benefits of limitations on physical therapy?
Okay. Now, somebody asked the benefits of physical therapy, right? So, with Medicare Advantage plan, when you access care, right? If you go to physical therapy, you'd have to pay co-payments, right? It could vary $75, $150, even more, depending on the plan, depending on what kind of Medicare Advantage plan you have, right? If you have the Red, White, and Blue card, right? If your doctor does the procedure, right, for the physical therapy, the person's gonna let you know whether it's gonna be covered, right? And what's gonna be your responsibility. If it's covered, you're gonna be responsible for 20% co-insurance. Also, I told you guys, like, depending on what kind of secondary insurance you have, right? Medicaid, retiree health insurance, or Medigap, it's gonna be covered eventually.
And if you don't have Medicare Advantage, you have the traditional Medicare.
Yeah, then you have the choice of Medigap. Medigap, if you have a Medigap plan, Medigap would cover 20% co-insurance. 20% co-insurance. Okay. Good. Yes. Any other question?
Medigap, what is it? Tell me about it.
Okay. Yeah. So somebody asked, what's a Medigap plan? A Medigap is a private plan that covers your 20% co-insurance. Because remember, in the beginning of the presentation, I said that Medicare is not free, right? Medicare pays 80% and you're responsible for 20% co-insurance, right? The private Medigap plans, they are a 10 standard plan, A to N. A as in Apple, N as in Nancy, right? They are standard. And they cover your 20% co-insurance, right? It is very important to remember that everyone with Medicare, they have a secondary insurance to cover the 20% co-insurance. Someone in the chat asked, do you consider pension for Medicare Savings Program plan? Yes. Anything that you get, your monthly income is counted towards your Medicare savings program.
Where do you get Medigap insurance policies?
So if you go to the, if you type www.dfsny, you're going to see Medigap plans.
What I didn't understand. DFSI?
Yeah, dfs.ny. Department of Financial Services.ny. Or you could call us. You could call us. We're going to go through all the plans with you. Yeah, however you're comfortable. If you're a tech person, I said in the beginning of the presentation, if you're a tech person, you could do it yourself. If you're like somebody telephonic, you could call us. You could call 1-800-Medicare. They're going to do the same thing. Okay.
So that's DFSI. What is the rest of it?
No, I'm going to put it in the chat. Is that okay?
Okay, fine.
Sure. see. Give me a second. I'm gonna put it in the chat again. So for you guys to see it. So if you go there, you could see the Medicare plans. I put the link, all right? I'm gonna delete that one so it's easy. I put the link for Medicare plans in the chat. If you're someone who wants to look into it, you can go ahead and check it.
Hi, can I ask a question?
Yes, go ahead.
Okay, so I know Part A is the hospitalization under Medicare, Part B
Yes,
is the outpatient.
Yes,
Part-
outpatient.
Part C is
The
Medicare
Medicare
Advantage?
Advantage plan, yeah. Part
And
C,
what's-
actually, like I said, it's the Medicare Advantage plan, right? It's your combination of Part A, hospital insurance, Part B, medical insurance, and Part D, prescription drug, all under one plan. That's called the
Okay.
Part C. Yes, Medicare Advantage.
And what is Part D? I have
Part D,
here,
D for drug, prescription drug plan.
oh, okay, so you need a separate insurance for that.
You need a separate standalone Part D plan if you are with the red, white, and blue card. The
Right.
original traditional Medicare you receive from the Social Security Administration.
Okay, thank you.
You're very welcome. One person asked, what is OTC card? Well, OTC stands for over the counter. Yeah. Now, yeah, you got, so here's the thing, you got OTC through the private plans, like the Health First, Metro Plus, Cigna, like, there are different plans depending on how much they offer. What you can do with OTC card, that's a good question. Well, you can buy groceries, fresh foods, you can pay utility bills, gym membership, buy fitness records, all those kind of things. Most of the plans do offer it quarterly. So every 3 months, you receive an incentive, right? Every 3 months. That means 4 times a year. It could be anywhere from $100 to $400, even more, depending on the plan.
Are you finished with this, Bill? Are you?
Yeah, do you want to stay? It's up to you whenever you want to stop.
I'm sorry?
I'm sorry, I was talking to somebody else. I didn't realize I was unmuted.
Oh, that's it. Any other question? But if you have more question, I know, like,
I
don't
have
wanna-
a question. Can you hear
Go
me?
ahead. Yes,
Okay. With regard to Part D for drugs,
yes.
at one time, if you hadn't signed up for that at the
Mhm.
time you began your Medicare, you would have to pay additional money, more than you would if you had signed up.
That's a good question, Carl. So there is a 1% penalty, right? There is a 1% penalty nationwide, and you know what's the penalty? It's $0.36. So 0.36, it's nothing. So if you, it's way less than $1, right? So if you delayed 7 months, so it's gonna be 7 times 0.36, maybe like $1 or something.
Yeah.
Yep. Yep.
Times the
130.
number of years, times the number of years in
Yeah.
which you delayed in signing up.
Yeah, but if you do the math, 0.36, but it's like way less. 0.36 is like less than 40 cents.
Why is that there? Why is there a penalty for that?
It's the policy. That's how the policy was made.
Okay, is there any indication that that's going to be free, that is not a penalty?
Ms. Carol, for 2026, nothing is official. I'm reading a lot of things myself. If it's official, when I come here again, I'm definitely gonna let you know. It's my responsibility.
Okay,
Sure.
Just
okay.
Yes.
we.
Right.
Speaker, sort of, this system was started, the hearing, the eyes, and the dental.
The dental.
Included. Someone asks, why? If you're aging, these are probably the areas that you're going to experience the most. And she said, well, I think that you've answered your own question. That when they made up this system, as you're aging, they knew for sure that your hearing, your eyes, and your teeth are going to be impacted. Therefore, they eliminated this from the benefits that they put.
Good question.
Again, is that true?
So good question. So there is a question, it goes, why the dental and the vision and the hearing aids are excluded from original traditional Medicare, the red, white, and blue card you received from Social Security Administration? Well, when the policy was made, they excluded those from original traditional Medicare, right? And on the other hand, the Medicare Advantage plan, they cover this, right? The private plans that you get from Marketplace, when you turn 65, they cover those plans. So it's your choice, like, what you need the most. If you need the dental and the vision and the hearing aids more, and you speak to your doctor and you decide like you want to get into a Medicare Advantage plan, that's your choice, right? If you think, no, I need the most amount of coverage, right? Because the red, white, and blue card, most of the providers takes it, right? In the United States and its territories, Virgin Island, right? Okay. So depending on your need, you need the most amount of coverage, or you have the most amount of providers, or you need like particular to the dental and the vision and the hearing aids. Okay. So depending on what you need, you speak to your doctor and then you decide which plan is best for you.
Do you have to pay that?
No, if you go with the Medicare Advantage plan, those are some of the covered services mostly. You speak to Health First, or if you speak to MetroPlus, if you speak to Cigna, Humana, United Healthcare, you ask them, are these the benefits, some of the benefits I'm going to get through my plan? They're going to let you know.
AARP included in these that you just mentioned?
Ma'am, you have to speak to AARP. You have to speak to United Healthcare. The other words is United Healthcare, guys. They call it AARP or United Healthcare.
Thank you.
You're very welcome. Or if you go with the original traditional Medicare, I'm pretty sure like there are some cheap dental, vision, and hearing aid plan you could buy for $20 or more, a little bit. Yeah. Okay. You could buy a separate plan. Yeah.
Thank you.
You're very welcome.
Is it true that in the Part C, right?
Yes.
Medicare Advantage, sometimes you have to go like within a network where you have to have referrals and things like that?
I'm sorry, I couldn't catch your question. Can you repeat it? I apologize.
Sure. I'm asking if the Medicare Advantage plans require a referral or a network.
Oh, okay. So that's a good question, right? So Medicare, like, I didn't touch on those things in my presentation because I don't want to overwhelm you guys. There are two different plans, right? You have the HMO plan. It's called Health Maintenance Organization, which is more sort of a restricted plan, right? Most restricted plan, you have to be in network with the providers who takes that plan. On the other side, you have a PPO plan. It's called Preferred Provider Organization, right? It's more sort of you could go out of the network and see a provider or a specialist of your need. So depending on what kind of plan you have, right, PPO or HMO, and depending on what kind of Medicare Advantage plan you have, you might need an authorization to see a different provider. You have to speak to your particular plan that you have for your Medicare plan. Okay.
I have a second question.
Go ahead.
Regarding in-hospital care, is there
Yes.
an advantage
Inpatient.
to have Part A as opposed to Part, what is it? I confused with
Part
all.
B.
Yeah.
Okay, so good question. Now, if you are working past 65, and you have an employer insurance, I recommend beneficiaries not to sign up for Part B. You know why? Because Part B has a premium, $185. Because remember, you are covered under your employer insurance, right? If you're working past 65, you don't have to necessarily get into Part B. You can get into Part A as early as 65. Why? Part A is premium free. You don't have any premium. Unless you're admitted to a hospital for first 60 days, Medicare pays everything except the deductible. What is it? $676, right? I mentioned earlier, $676. So if you're, like I said, if you're working past 65, don't get into Part B. Why you want to pay extra $185? Because you are still covered under your active employer insurance. Okay.
I'm sorry, what I was meant to ask was about Part C.
Part-
If
oh.
you have a Medicare Advantage, how is that with hospitalizations? Is it as effective as Part A?
Oh, I'm sorry. Okay, so depending on what kind of plan you have, you'd have to speak to them. If you have health first, you'd have to speak to them how their plan is, because it always changes every year, though. You know, because these are private plans. You'd have to speak to the particular plan and see like what are the things they are covering. Okay. Yes. Yes. Someone asked like about the annual election period, which is from October 15 to December 7. You can change your plan during that time. If you change your plan during that time, your new plan is going to start January 1st, 2026. That's what they call the annual election period. In other words, AEP. Someone in the chat asked, do they consider pension? I already covered that. Sorry. Yeah, I covered that. Yeah. Any question? Yes.
Want to see all your drugs, what medications you take. If there's a possibility that your insurance company, for one reason or another, does not accept the drug, what would be your next step other than pay for the drug yourself?
Great question. Great question. Right. So someone asked, when it comes to drugs, right? Not all the drugs are covered under one plan, right? Because you have tiers. You have tier 1, tier 2, tier 3, so on and so forth. The person asks, what you gonna do in that case? Are you gonna pay out of pocket? Good question. Well, in that case, you ask your provider to provide you a separate drug for that particular drug, which you have to pay out of pocket. Mostly, drugs that are branded are not covered. So you can ask your provider if there's a generic drug, right, that is compared like that you could replace the drug which is branded. That way you don't have to pay out of pocket. It's going to be covered, right? You're reducing the tier. Okay, good question. Yeah. Any other question? Going once, going twice. Well, thank you so much. I'm gonna go ahead and conclude the presentation. Really want to thank you for being here today. Thank you so much.
Thank you.
Yeah, thank you.